Point, the voice of national unity, and I'm David Coty. If you are there now, you can call and ask your questions. Good morning.
Yeah, good morning, Mr. Coty.
Good morning to you.
And good morning to the judge. I'm coming calling from Liverpool Street.
Okay.
My concern has to do with what happened for me who may I want to do my general medical care. What will it cost me?
Oh, to do your general medical checkup. What would it cost you? Okay, they're going to answer you. Thank you. 077-511-977, 0886-511-977. If you're there, you can call those two numbers, one of them, and we're going to answer you. All right, let's try this. Good morning.
Good morning.
Good morning.
What about is this? Because I just got in the program, I heard a little bit of it, so I'm interested.
Okay.
My name is South Samola in Brooklyn.
Oh, okay.
Where about is this location, the location of this?
The location of Jahmele Medical Solutions. That's a good question. Thank you. They're going to answer you. 077-511-97. All right, let's take this caller. Good morning.
Good morning, Mr. Coty.
Good morning to you.
I'm Andrew Coco calling from Tototo.
Oh, from Totuta. That's good. Go ahead.
Thank you for the program. I monitor you very well.
Thank you.
And my question today is Jahmele doing diagnosis. So why they can't try to treat the patient? Because normally do diagnosis and send to GX and yet they never want it. Oh, call yet they go to GX sometimes. Once they do the operation, so now put one into the body also I recommend that you at least try to get the lab so trying to kind of or let them be able to treat the patient now instead of trying to refer to different hospital.
That sounds good. They should have a full hospital. That's what you mean.
Full hospital.
All right. They're hearing you. I'm sure they're going to work on it. Thank you. So, good question.
Thank you.
All right. Good morning.
Good morning.
Good morning.
I'm CB Arusawa. I'm calling from Kendall
Oh,
University campus.
Oh, good, good. Okay. Yeah. Go ahead.
I appreciate our CPS and our doctors being there.
Mm-hmm.
But I would like to the finance man is not there, but I would like for people to share the number, the finance number with us so that we contact them to know what the cost for these tests to be done.
Okay.
I'm CB Arusawa again.
Thank you. All right.
Okay.
That's a good point. I'm going to give you some numbers. Yeah. 077-511-977, 0886-511-977. Good morning. Good morning. Yes.
My name is Anthony Gasicoli. I'm calling from the 9th Street here.
Oh, 9th Street. Okay, go ahead.
I'm able to
Yeah, you are grateful to the studio guests, but you got to speak louder so they can get you now. It will.
but I was over the last question you asked.
Uh-huh.
That's where after doing testing and you making the video.
Oh, when you get there, you can discuss that with them. We can't see all that here now. I only ask that because maybe I want my video to see myself. But yeah, you're right. But they will answer that. They will tell you how they can handle that. All right. Okay. Good morning. Yeah. Yeah, but you got to talk so we can hear you.
Yeah, I'm saying I'm calling for the Israel community.
Okay, where's the Israel community? Oh, okay. Go ahead quickly, please.
Yeah, I want to
But we're not getting my brother. If you're still sleeping, then we can go to somebody else. I'm not getting you then.
I'm saying I want to ask a student test.
Uh-huh.
I want to do a test.
Uh-huh.
Maybe I have a cricket in my body and then I can't understand what a cricket comes from. We want to test what will be introduced to.
Oh, okay. Thank you. They're going to answer that. All right. Good morning. Good morning. Okay. 077-511-977, 0886-511-977. Good morning. Yeah.
Can they do surgical on that lower back pain?
Okay. Surgical or lower back pain test. All right. I'm sure they can do that. Good morning.
Good morning, Mr. Kuti. How are you doing?
You're very lively. I like that. Good morning to you.
Yeah, good morning to your guest.
Okay.
Thank you so much for the program. You are really doing well for us.
Thank you.
But that health center is very good. They have good treatment. They have good medicine. They have many things. But the problem is that the cost of it I went there once, but the cost at least they have to reduce the cost because although they have good treatment,
Okay.
the best in this country, but at least the cost to in this country. So
But hey, if you want good woman, you gotta spend good money.
no, she was
Hey, you want fine woman, you gotta spend good money. Oh.
I'm confused.
All right. You want to eat good food, you gotta spend good money. All right. Anyway, thank you. They will answer you on that. Yeah. Thank you. They're gonna answer that. All right. All right. Good morning.
Morning.
Good morning.
Yeah, I'm Jahmele Medical. I'm calling from Singapore.
Okay, go ahead.
Yeah, one of your caller call and say the people should try to get hospital. Yeah, if you to get hospital and then to tell you your problem and then be thinking on it. Someone that will tell you your problem will be able to solve your problem.
All right.
Yeah.
But
so
I think,
that is right.
yeah, I think the first thing is to know that problem. You know, a hospital without a laboratory is not a hospital. This whole medical thing is not a guessing work. So let's be happy that they even have the diagnosis center where they can tell you a real problem. I think you're right.
I'm very happy because I want to save many lives.
Yeah, yeah.
Because getting clean, going to other people's country,
Yeah.
looking for hotel, looking for someone to take care of you, all of that,
Oh,
right?
plenty of money.
Coming here, that they Jesus Christ for us. So we like that.
Somebody is calling you the Jesus Christ for Liberia. That's good. All right, that sounds good. Thank you. Well, they're taking into consideration. Thank you. All right, they want you to have a full hospital. Think about it. 0777 511 977 and 0886 511 977. Good morning. Oh, what they can do? Eye also. Eye diagnosis. What they can check
okay.
eyes also. That sounds good. All right, they're going to answer that. All right, we still got about a few more minutes to take some calls. Our format here is that we take calls for 15 minutes and we'll go back to our guest. 0777 511 977 0886 511 977. All right, we can take one more call, then we'll go back to our guest. Or maybe we'll start right here. If a call comes in, we'll take it later. Now, you talked on some points, Dr. Wubet and Mr. Jackson. Let's attempt to answer them, but may I call these numbers first? Because somebody talk about. All right. All right. Those of you who want the numbers for Jahmele, to be able to go there, if you want to call, they have a very important and a very good branch at. Okay, let's take this one. Hello. Hello. Yeah, you got the radio on. You got to cut it off. Okay, go ahead. Hey, D-War.
Yeah, Papa.
Please permit me to call you political D-War. Anyway, go ahead.
I have some problem with my phone.
With your what?
I went to my
Uh-huh.
and I went to GSP.
Uh-huh.
I went there. The case to this scan they're talking about, I did it and it came to $150.
Mm-hmm.
I paid it. For them to say, oh, that's in my phone here. They told me to buy 7 tablets. I bought a whole batch. And the doctor told me that when I take it, when it's finished, it's okay, but when it's finished, I'll have to do operation. So I'm afraid. When the guy is talking about operation, first can be coming from there.
Okay.
So I don't know what to do.
Okay, you said which part of your body?
My gum.
Your gum. Okay.
Yeah, where I'm chewing from.
All right.
That's my front gum.
Okay. All right. They're going to tell you what it should be. All right. They will answer that for you. Thank you, D-War, for calling.
Okay.
Yeah. Thank you. Okay. I think we can hold a call so now, or else 2 minute questions. We will not be. Let's go ahead. Go ahead and answer your questions. Oh, I was on the number issue first.
Yes.
All right. If you want to go to Jahmele Medical Solutions, especially at ERWA here, they are at the ERWA junction.
Yes.
For those of you who do not know, just where they have the NASCO building, right there. Call 0881 63,000. 0881 63,000 or 0776 63,000. 0776 63,000. Now they open from Monday to Friday from 8:30 a.m. to 6 p.m. You need to know that. On Saturdays, they open from 8:30 a.m. to 1 p.m. Let me read that again. From Monday to Friday, you want to go to Jahmele right here at the ERWA junction. It's 8:30 a.m. to 6 p.m. Monday to Friday. And Saturday from 8:30 a.m. to 1 p.m. Now, for the imaging area, those of you who want to check your whole body to know what's happening here and there, image with the fluoroscopy, you can call 0775 60 30 33. 0775 60 30 33 or 0775 60 30 34. 60 30 34. Those are numbers. We'll call it again before the show ends. But if you want to go Nuclear Town, where they have a very good branch, where I have done 2 medical checkups. They have 2 full doctors there. I mean, they will check you well. I have done my general checkup there 2 different times. And it is cheaper there because of the community. They have the same equipment, no difference. But they will check you there, and it's a little cheaper there. It was cheap, so I went there, and it was okay with me. Now, you can call the Nuclear Town group on 0881 60 30 78. So if you're in Broadville now or Virginia listening to me, call 0881 60 30 78 or 0776 60 30 78. They are there from 9 a.m. to 4 p.m. Go ahead, please answer these questions.
Yeah.
Okay.
Yeah.
Thank you very much. First of all, one thing I noticed is that several callers talk about one thing in common. That is
Please talk to the mic.
yeah, that is treatment. They talk about treatment. Someone said why no treatment, and then another person talk about general checkup. Another person talk about us having a full hospital, things like that. So what I want to say is that we do have a clinic. Okay, we do have a clinic, and at the clinic we have our physicians. They are there.
That's what I know.
Yeah, we have our physicians. They are there.
Yeah.
They can check you. They can order investigations, imaging, or laboratory investigations, and they are going to treat you.
Okay.
What we don't have for now is an inpatient service.
Okay.
Meaning we cannot put you on bed.
To sleep on bed.
Yes, good.
Okay.
That's what we don't have for now.
I was concerned when I have done some treatments there before.
Yes. So we do treat people. You want to do a general checkup? You are welcome. You can come check out our clinic. Our physicians are there, very good doctors. They are going to check you, whatever it is, and you are going to get treated. Okay, so we do treatment.
Okay.
Just that we don't admit patients.
All right. Okay.
Yeah, we don't admit patients. And then another person talked about surgery for lower back pain. Yes, so our physicians are there. Like I said, you're welcome. You can come.
Yeah.
We are going to check you.
Dr. Konawa is there.
Dr. Konawa is there.
Dr. Moses Tarawale is
Dr.
there.
Tarawale is there.
Yeah.
And the others. So,
There are specialists, sorry.
Yeah.
Yeah,
There are specialists for a lot of areas. Actually. Yes.
Let them get that clear.
Yes.
There are specialists for all of these different areas.
Yes.
That's the good thing about Jahmele. Yeah.
So if your complaint is about bone issue orthopedic, we have our orthopedic specialist. If it is a child pediatric, we have our pediatric specialist, and so on.
Children doctors.
Yes.
Yes.
Now let me take this one, please. Just 1 minute. Hello.
Yeah, Mr. Cody.
Yeah.
Yeah, I'm kind of calling back. You know, that has not been clear. The question I was asking, I said, okay, for me, I know my full membership. If I want to come and do my general checkup, what would it cost? So that
I just gave you, listen now, this whole thing about health is not poor man business. I'm sorry for saying. You have to find, I'm coming, my brother. You have to find a way to get yourself treated. Even if you have to go work for somebody or beg somebody, do it. If you sit there and keep talking about being poor, you might never be okay. So I just gave you some numbers. Call these numbers, and they're going to answer you. They will tell you what it will cost and how you can do the payment. So please, yeah. All right. Yeah, please go ahead.
Go ahead.
Yeah. So like I was saying, we do have a clinic. Our physicians are there, specialist physicians, so you can come and see us. Besides that, we have special packages, okay, for our clients.
Oh, okay.
So yes, special packages. So you just need to reach us. We are located at ELWA Junction. Reach us. People are there to talk to you. Whatever the problem is, we are going to talk to you, and you'll be fine. Okay. So the thing is, just come to us. Reach to us. We are there. We will talk to
Yeah,
you.
all of your questions will be answered.
Yes,
Yeah.
your questions will be answered. No need to worry.
There's no way you can treat anybody by radio.
No. So
They have to be there.
Yes,
Yeah.
yeah, definitely. So you need to come. We are there for you. We're going to talk to you, and the issue will be solved. Yeah. And then another person talk about location, like we have been saying it, we have stated that already. The location of Jahmele, that's ELWA Junction. If you talk about road where we have the overhead bridge,
Yeah.
that is the hospital. Okay. We have
Right by the
overhead
LRA.
bridge. Yeah. So I think if there's another thing that you can add up.
Okay, yeah. So there are also questions like eye diagnosis and gum diagnosis.
Right.
So my recent information is Jahmele is on the way of establishing the ophthalmology, which means eye center or unit, and also the dental, which means the person who raised about the gum issue. So they will soon be available. This service will soon be available.
That sounds good.
In Jahmele, yes.
Okay.
Good.
Now you got it clear from Dr. Wubet. Jahmele is now thinking about having ophthalmologists. Ophthalmologists are doctors who treat the eye. Oh yeah, they'll soon be having it. And he's just telling you that they're going to have a dental department also. If you have a teeth problem, you better do it. I was recently at ELWA where I did my cleaning of my teeth. And this guy did a video for me. And it looks like I'll be switching out to Jahmele saying it's closer to me. So you don't know how soon that's going to be, but they will call these numbers and it will be told. But it is good news to learn that you're going to have that ophthalmology department. I mean, that sounds good. All right. So maybe you have some other questions there on the other points?
Oh, I think they are covered.
Okay, most of them, yeah.
We normally take calls for 15 minutes, but we took calls for 10 minutes. So if you are still there and you have a point to make, question as you can call. So D-Wall, I hope you're listening. She talked about being afraid to do operation. Let me say to you, I am not a doctor, but I'm the doctor's friend. In politics, they call me the president's friend. All the presidents, I'm very friendly with them. And some people call me a regime collaborator. That's your business. I will always be friendly with every president, a regime collaborator. But I'm also the doctor's friends. Let me tell you, D-Wall, don't be afraid to do your operation. You said since it told you about your gum issue, you've been afraid. Don't be afraid. It is the same thing that happened when it comes when it came to this eye issue. I remember I brought in Dr. He's an ophthalmologist, the head ophthalmologist at JFK. He's gone back and he used to be the head there. People used to be afraid to go and do operations because people lie to them, saying that when you go to JFK or anywhere to do an eye surgery to remove a cataract, they're going to remove your eyeball. And Dr. Naraji Perry, the head ophthalmologist at JFK, came here and said, no, that's not true. Nobody's going to remove your eyeball. It will stay right there and it will be operated upon. And I gave the testimony. I have done two. There are two new lenses in my eye right now. Two new ones. 1 year. It's there forever. They were removed at the JFK and they put in two new ones. Nobody removed my eye. Because if they remove your eyeball, the optic nerve at the back of the eye will be destroyed. And once the optic nerve that is at the back of the eye connected to the brain, giving you a signal to see, when that is cut or damaged, you will see no more. So nobody remove my eye. So D-Wall, don't be afraid. Go for the surgery. It is better than for you to let it be there for a long time. It will cause trouble for you. You're my friend, my good sister. We are all in political business, but please don't be afraid. Go do it. All right? Hello?
Hello?
Yes?
Yeah, my question, no,
Take your time, buddy. Take your time.
Okay, can I add something about
please
this?
answer.
Okay, so when it comes about fear of a medical treatment in general, it all comes about the professional and the patient. So I urge everyone here that the patient has to hear or be clarified from the right person, from the right professional.
Yes.
It's
That's a
not,
good point.
yes, from the right professional. So it will be clear, and patients usually come to understand about their condition, about their procedure, any test when they hear from the right person,
Yeah.
from the right professional.
I
That
agree
is the key thing. Otherwise,
yeah.
listening from collaterals like non-professional people or on social media maybe may not be good. Okay, so that's what I have to say. Again, you have yes, you have to come face to face with your professional, with the right person, okay, and hear from the right professional for the right procedure
I
and
support
treatment and test.
I support that.
Yes.
But how would they know the right person? That's the problem. This is why I think the government should come in. What Dr. Wubet is suggested. He's saying, in other words, that some of you have the right to be afraid because of what is happening in some places.
Yes.
In Cape Town County, there's a place called, okay, I don't want to call the main name, but it's in Grand Cape Town County. A fellow said he had an eye problem, and somebody said they could treat the eye, and they damaged his eye for good. So I think you're right.
Yes.
The best thing is to go to the right place and to the right person. And when the right people touch your eyes, my friend, it'll be okay for you.
Yeah.
So you're making a good point. It's not only having the equipment, but to have the right person to use the equipment.
Yes.
Yeah. And sometimes you have the right person who is a good medical doctor, but don't have the equipment. This is what makes Jahmele unique. You have the equipment and you have the expertise.
Yes.
In fact, professional equipment, not just equipment.
Definitely.
They are there. So those numbers that I will call them again. You can go there, call them, and it will give you some information. Right here at ERWA Junction, the head place at Jahmele, 0881 60 3000, 0881 60 3000, and 0776 60 3000. Those are numbers you can call to go to the Jahmele hospital or clinic right here at ERWA. If you want to go to the imaging area, those of you who are concerned about doing some imaging to know what's happening in your system, you can call the fluoroscopy department or the MRI department or the other one. Just call 0775 60 30 33. 0775 60 30 33 or 0775 60 30 34. If you want to go to Newtown, you're from Virginia, Broadville, or Caldwell, call 0881 60 30 78. 0776 60 30 78. All right? You can call those numbers and go get more information as to what to do and what not to do. Okay, we got roughly 5 more minutes to go. What are your final comments to the public?
Okay, so I want to say something about infertility.
Yeah,
during my professional practice in Liberia, I was able to observe infertility is common, extremely widespread in Liberia. Infertility, which means inability to conceive.
Yeah.
So one of the commonest causes for infertility is blockage of the fallopian tubes, as we mentioned before.
Yeah.
Actually, by far the commonest is the a problem in the fallopian tubes. So I also mentioned before that the gold standard or the best test for imaging or testing to see the fallopian tubes is fluoroscopy. It has never been replaced by modern MRI, modern CT scan, or any other imaging test in the world to date. So I urge the public to use this digital fluoroscopy, as I said, for infertility is common, to test or to use in the workup and testing of infertility. Also, medical professionals all over Liberia, I urge them to use this digital fluoroscopy for the testing and imaging of the fallopian tubes and infertility workup in general. That's my point. Finally.
Thank you. Let me just emphasize on that. So I'll come to you, Mr. Jackson. Okay. Infertility, when you can't get pregnant as a woman, that's what he's saying here. He is saying that the best solution is to do your fluoroscopy. It has not been replaced by any other machine. Even the modern CT scan, the modern MRI can pass the fluoroscopy. You must do that to know the main problem in there, especially when it comes to the fallopian tube. That tube that the egg can pass through to join the sperm to make the ovulation period.
Yes.
So you have to go to the Jahmele hospital if you are somebody suffering from infertility. Infertility is woman you can't get pregnant. And what I have always emphasized is that to men, if you're married to a woman and she cannot get pregnant, don't be quick to divorce her. Go and check yourself first, because men can also suffer from infertility. Oh yes,
that's right.
You can be the cause of your woman not getting pregnant. It's not only woman. So the mothers-in-law are the problems. The mothers-in-laws of the let's say the woman's the married woman's mother-in-law. Every day they're throwing hints. This thing here getting too much now. Since my son been married to you for 2 years, you cannot get pregnant. I think he needs to find another woman. Woman, before you tell that woman, tell your son to find another woman, tell your son first to go and check himself. Infertility in men is possible. They got infertility in women, infertility in men. What do you have to say, Mr. Jackson?
Yeah, when it comes to healthcare in general, in order to get the best patient outcome, there are two basic factors that should be present. And they include having the best expertise,
right,
that is the professionals,
yeah,
and also having the best equipment.
That's correct.
Okay, there are cases where the expertise are present, but now you don't have the best equipment.
No.
Okay, but now at Jahmele, we have all.
Okay.
We have professionals, the expertise are there, plus the best equipment.
Yeah, that I know.
Yes. So Liberians, you need to take advantage of this. Take advantage of this. The professionals are there ready, waiting, set to see you.
Yeah.
The equipments are there.
Yeah.
Everything.
Right.
So you need to move. You need to take a step. Come to us. Reach to us at Jahmele,
right,
and you'll be fine.
You'll be fine.
The best patient outcome. We are going to do that for you.
That. And you're not just sitting because you want to talk. I'm a testimony of that.
Okay, good.
Yeah, we can tell the public. I want to say many thanks to you for coming.
Thank you.
Thank you for appearing this morning to help the public help themselves. Okay. And I'd like to say to you, as a friend of all doctors, please, you don't just sit home for 365 days around the clock. The first medicine to good health is early detection. Whether you feel sick or not, go to the hospital and check yourself. Something may be wrong in there. There's a medical term called multimorbidity. Multimorbidity simply means having two or more life-threatening diseases at the same time. For example, you have cervical cancer as a woman. You also have breast cancer and maybe diabetes. 3 life-threatening diseases at the same time. You don't know. You're sitting there. You could die from it. If you're a man, you are suffering from benign prostatic hyperplasia or or prostate enlargement. I want to act like a doctor this morning.
Yes.
Benign prostatic hyperplasia is simply prostate enlargement. You have it. Then you also have prostate cancer, and you don't know. And you can have both at the same time. Both can kill you. Prostate cancer can kill you, and prostate enlargement can kill you. And you have all 2 at the same time, and you don't know. You're sitting there. Please, early detection is the first medicine that could help. The program has been Flashpoint. We're going to be here next Friday, perhaps with another medical doctor or one politician. Like I said, I'm paying money here. I got to look for money to pay my bills. So I will contact somebody to be here next week. Thank you very much, and thank you for coming.
Thank you so much for having us.
We're on Facebook. Go and watch it, and please share the show. Within 2 or 3 hours, we're going to be on YouTube. Thank you very much, and have a good day. Bye-bye.